Hey everyone, welcome back to my channel. Today I'm going to talk about alcohol withdrawal. I'm touching upon this because this topic trips me up a lot when it comes to presentation and correlating it with the time frame. So I thought let me just clarify it for myself and you guys once and for all. So what I'm going to do is first give you a few basics about alcohol and why withdrawal presents the way it does. So alcohol acts very similarly to the neurotransmitter GABA, okay, in the CNS, and you all already know that GABA is an inhibitory neurotransmitter. It maintains an inhibitory tone in the CNS. Now, what happens when you when someone consumes alcohol for a long time is that it's acting like GABA, so it keeps them in like a nice, calm, sedated state. You can think of it that way. And when you withdraw alcohol, right? Suddenly there's going to be an activation of the CNS, the ANS, and the somatic nervous system, right? I mean, it makes logical sense, doesn't it? It's been acting inhibitory for a long time, and then you remove it, then there's going to be some amount of rebound activation, right? So now, how does it present vis-a-vis the time frame, right? So we're going to divide it into 3 time frames. The first one is 6 to 24 hours. The second one is 12 to 48 hours. And the last one is 48 to 96 hours. For this, you want to think of it as getting progressively worse, because at first it's just tremors and anxiety, right? We would think of this as being pretty benign. Then it gets even more complex than that, in the sense that the patient starts having seizures and hallucinations, right? And finally, the final stage is what they call DT, which stands for delirium tremens, right? And this presents with agitation. You'll notice that at first it was just anxiety and now it's progressed to agitation, and abnormal vitals, right? Abnormal vitals. And with abnormal vitals, we're talking about, irregularities in breathing and blood pressure, heart rate, and all of that. Whenever your vitals are going out of whack, you always know that it's serious, because your basic body physiology is dysfunctional, right? So this one is the worst, right? It's just getting progressively worse. So you can think of it that way to help remember what happens when with respect to alcohol withdrawal. And this is the structure of the GABA receptor, and this is the lorazepam binding site and the GABA binding site. I wrote this down to tell y'all that we use benzodiazepine. Lorazepam is a benzodiazepine. Benzodiazepines to manage alcohol withdrawal, right? Other than that, it will be like supportive care, like, monitor the vitals and give them fluids if necessary, and just give them supportive care plus benzodiazepines. When you write your boards, a lot of the time they will give antipsychotics as an option, right? Because some symptoms of alcohol withdrawal, like hallucinations, for instance, they can resemble a psychotic feature, but the important thing to remember is that you're not supposed to use antipsychotics for alcohol withdrawal, because alcohol withdrawal already increases your it decreases your threshold for seizures, and antipsychotics tend to decrease it even more, and then the patient might have seizures, right? So you're not supposed to pick antipsychotics even if it's there in the options. You always want to go for a benzodiazepine, all right? And I think antipsychotics can be used maybe like as a last line drug if it's not responding to benzodiazepines, but this is an important thing to remember. It decreases the seizure threshold, all right? So that's about alcohol withdrawal. I hope I made it clear for you all. I know I was very confused and I had a little trouble learning at first, but now that I've thought of it as getting progressively worse, and I remember that it's benzodiazepines and not antipsychotics, I don't have any problem diagnosing or treating these cases, especially when it shows up in a vignette form. So don't get confused, just think logically and you'll be fine. Thank you so much for listening. I hope that this was helpful. I'll see you again soon. Bye-bye.